Abortion is the process of termination of a pregnancy before birth, with the consequent death of the fetus. If the fetus does not develop normally, abortion may occur, or the mother suffers from an injury or disorder. There is prevention on her part to stretch the pregnancy to its full term. Such spontaneous abortion is generally called as miscarriage. In 3 to 15% cases, pregnancy terminates prematurely in miscarriage. Indulgence in intercourse soon after the bleeding incidental to a miscarriage stops results in most cases in renewed pregnancy. If the causes of the previous miscarriage have not been understood and provided against, such repeated pregnancies may prove dangerous to the woman concerned in many ways. Cesarean delivery methods of abortion are induced abortion, drug-based abortion, and surgical abortion. Induced abortions are carried out by using surgical procedure or drugs. The safest as well as suitable method is with the determination of the age of the fetus, which is calculated from the starting and ending menstrual period of the pregnant woman. Most of the pregnancies last for approximately 40 weeks. These weeks are divided into 3 stages which are called as trimesters. The first 13 weeks is the first trimester, from 14 to 28 weeks is the second trimester, and from the 29th week to birth is the third trimester. During first trimester, if abortion occurs, it will be easier as well as safer to carry out, while abortions during the second and third trimesters involves more complicated problems as well as great risks to the health of the woman. After 12 weeks itself, the risk increases by 30% of pregnancy each week. Abortion, drug-based abortion, is also called as medication abortion. This type of abortion is caused due to medicines. There are 2 types of drugs. The first type of drug is mifepristone, which blocks progesterone, and the other drug is misoprostol, which causes pain and contractions in the uterus. These uterine contractions drive out the fetus and causes ultimate destruction. Combination of another type of drug induces abortion with the usage of misoprostol with methotrexate is an anti-cancer drug which interferes the cell division. The medical practitioner first injects the pregnant woman with methotrexate. After a week later, the woman takes a tablet containing misoprostol to induce contractions in the uterine, as well as drive out the fetus and bring about its destruction. Abortion, surgical abortion, is done by the doctor who is well trained in surgeries. For inducing abortions, surgical methods are used. If a woman needed to remove pregnancy before it reaches 8 weeks, the medical practitioner normally carry out an early evacuation to uterus. For both the processes, a narrow tube which is known as cannula which is inserted through the cervix into the uterus. This tube is attached to a vacuum device, such as syringe, and are extracted the contents of the uterus including the fetus as whole. A smaller cannula is used for preemptive abortion, which is carried out in the first 4 to 6 weeks of pregnancy. In the early stage of uterine evacuation, larger cannula is used to carry out in the first 6 to 8 weeks of pregnancy. Abortion, for these 2 methods of abortion, that is surgical as well as preemptive abortions, there is no need of anesthesia. It can be carried out in a clinic or at medical practitioner's office. The entire process lasts for only a few minutes. Due to infection, preemptive abortion is caused. Woman who undertakes early evacuation to uterine, they may experience heavy bleeding for the first few days after the process. Thus, there are many other processes used for abortion, which are vacuum aspiration and dilation and curettage, as well as there are surgical methods for removal of fetus from the uterus, with the advancement of science and technology in medical realm.